So good morning, Mandy.
Good morning.
Thank you for joining us here. Today is May 6th, 2024. And besides leading one of the most important organizations in the world, taking care of the health of the United States and the world, I just want to let you know how tough it has been to compete against Mandy when she's at one of the world's leading schools of public health in North Carolina. So as many of you might know, we have the Milken Institute School of Public Health in GW. And so they have decided, and we need a strategy. And so they've asked Mandy to be the keynote speaker at their graduation. So
That's right.
Thank you very much.
I'll be there in a few weeks. Thank you.
So we like to remind everyone every year that more than 50% of all the economic growth in the world can be traced to public health and medical research. So yes, every life is precious, but it also has driven the world and the economy for the last 200 years. So we're 10 months in to the assignment. What has surprised you and what hasn't surprised you in these 10 months, Mandy?
Well, first, Mike, thank you for having me here and for opening up this conference in a discussion about public health. I think we all got to know public health in a new way through the pandemic, and we're in a new moment, a new chapter. And I think we realize that the health and security work and our economy are linked. And we saw it in big and small ways over the last number of years. And so as CDC is turning a new chapter and we are thinking about how do we meet this new moment, we need to be able to respond to whatever health threats are out there, whether that's chronic disease, heart disease is still the biggest killer out there, or a virus. I spend a lot of my time these past few weeks on avian flu. We need core capacity to respond to those health threats. And it can't be just in time. These are things that take time to build. Data capacity, the laboratory diagnostic capacity, the workforce, and the response capability. So what I'm trying to do is make sure folks know that we are in a new moment. We have lots of amazing tools, to your point, of the innovation that has been going on, but we have to make sure we're investing in this work.
So the demographics of the world we're in today have changed so dramatically. And the 10 countries with the highest birth rate in the world are all in sub-Saharan Africa. And so just one country in sub-Saharan Africa, Nigeria, had far more children born than all the children in North America, all the children born in Europe, etc. And so I know you've spent time visiting Ethiopia, Zambia, Kenya, etc. Why have you spent so much time visiting these countries?
Well, the important work of protecting the country's health actually starts abroad, making sure that we can identify and stop health threats before they would come to the United States. I was just in Ethiopia, and they are seeing more and more cases of measles. They've recently had internal conflict, and they haven't been able to vaccinate kids as much. And that has a direct impact back to the United States. We've been seeing more cases of measles, and again, that's a lot because of international travel and the level of vaccination we're able to do internationally. So those are kind of the important work. Or it's the work back to avian flu, right? We are looking for genetic changes in viruses all over the world. We want to be able to identify it and stop it at its source. And so we're working hard to make sure that we are forward deploying the folks we need internationally to protect us here at home.
So I don't think everyone has had an opportunity to visit the CDC. Security is fairly tight. A number of years ago, and I wrote about it last year in the book I put out, Faster Cures, our visits to CDC. And it was really an emotional experience for me and to be in that CDC museum and see an individual who had been kept alive with polio in an iron lung for a number of years. He lived in that iron lung. My father had polio. And it's hard for the world to see what goes on in the CDC because it's hard to get security clearance to visit. If you were to communicate and let people understand that one of the things that really struck the group I brought there was your situation room. They think there's situation rooms at the Pentagon or at the White House, but the situation room monitoring things all over the world, and there are actually people at the CDC that in any emergency have their bags packed to go. So let's talk about the view of the CDC that you could share with us today.
Sure. Well, CDC is, our mission is to protect health and improve lives. And we are a small but mighty team, and I will say that it is something where it has to be a team sport. We're doing a lot of that work, and we do have a lot of visibility, but we wouldn't have that visibility unless we had partners to make sure that we have eyes, ears, people to be able to respond to whatever the health threat is. And we've made a lot of progress over the course of COVID. I think going into that, we did not have the visibility we wanted. We didn't have the diagnostic capability. We've made a lot of strides, but we have more work to do. And I want to make sure that folks who are thinking about how do we keep our economy strong, how do we keep our workforce healthy, that they think about CDC and public health at large. And because if we don't invest foundationally in our health security, everything else can get shaky on top of that. And so what we're trying to do at CDC is help folks understand how we are moving into this new moment, learning the lessons of the past, turning our data into action more quickly, communicating clearly, and making sure we're investing in those core capabilities. But again, we need everyone's help in this because we know that protecting health and improving lives, that's a big job. And so I'm grateful for this conversation and these kinds of forums to be able to do that.
So people at our conference here in 2024 in May own or control over 3,000 companies. They have tens of millions of employees. And I think if you were discussing with them the reason for partnership, access to data, how they can help you and how you can help them. Good.
Well, thank you for that opportunity, because I think we absolutely need to focus on the employees right in front of us. I think businesses, of course, you want to have a healthy workforce that's productive. And so thinking about the health and well-being of them from the very beginning, but also particularly if you're a large employer and you're self-insured, right? It's dollars and cents, right? Having a healthier workforce means more money that you get to use on other parts of your business. So I think there are tons of things that businesses can do. Very, very basic, right? Many of you have been holding flu clinics for years. I hope this fall it'll be a flu and COVID vaccine clinic. We're already taking steps to update the COVID vaccine later this year. And we have to live with it. But again, these are tools we have. How many of your workers are out each and every winter because their kids get RSV, right? And so again, a loss of productivity, opportunity, thinking about how do you promote vaccination. That's an easy one. But then it's also things like mental health, right? How do we work together on improving mental health of our communities? So I think there's a lot of ways that businesses can think about the health and well-being, but they also need to be advocates for public health, because we can see how in a moment a virus can bring us to our knees. And so just like we need to invest in the military to protect us, we have to invest in public health to protect us as well.
The challenges, let's talk domestically now. We know that if you get on the subway in Manhattan and go towards the Bronx, that you lose life expectancy every minute. And it's 10 years shorter in a 20-minute ride. And so defining your life expectancy by the zip code you were born in. And it's not just New York and Chicago. A 15 to 20-minute ride will shorten average life expectancy. And maybe the most extreme in the country is in Baltimore, where you can go into a wealthy suburb whose life expectancy might be 15 to 20 years more than an inner city. How do you deal with this differentials and getting this into our communities?
Well, we certainly know it's a complex issue, so there's no one solution, but it is why CDC is focused on, in addition to being ready to respond to any health threat, we're focused on two other areas. One is improving mental health. We lost 100,000 people to overdose, 50,000 to suicide last year. And then the other part is supporting young families. And the reason we focus on young families is that the part of our lives, 0 to 10, that is when your lifelong patterns of health are determined. And so we really want to make sure mom is having a healthy pregnancy, that our kids are getting vaccinated, our kids are food secure, that they're housing secure, and that they are getting off to the best start in life no matter the zip code. And we also have to care about mom and dad's health, preventing diabetes, heart disease, stopping smoking. So that focus on young families is really important. And I think this is where the business community and public health, there's so much shared alignment there to work on, particularly as we think about young families.
So vaccines. As we've been focused on building the Center for Advancing the American Dream in Washington, D.C. over the last 10 years, across from the White House and Treasury, we have polled people, and we are so surprised how people don't really fully understand what vaccines have done for the world. And the people that created those vaccines or worked on those vaccines, and obviously in some cases we've seen challenges to taking those vaccines today. How do you see our ability to communicate the value of these vaccines, one, and how do you see our ability in the future to create or accelerate the creation of new vaccines?
Well, vaccinations have completely revolutionized how we're able to think about protecting health. So what an incredible advancements, and even the fact that we were able to go from where we were at the beginning of COVID to having a vaccine so quickly, just in a huge scientific marvel. And it gives us more platforms to build upon going forward in the future. But I think the core that we need to get to is even the best made vaccine that's fast, if it sits on the shelf, it does us no good. So we've been really focused on how do we think about that trust building for folks to understand vaccines, ask questions, but also to make sure we're combating misinformation. And I think this is, again, about getting more voices into the conversation. Trust is not built overnight. We have to make sure we're linking to trusted voices that can understand issues. We have to be answering questions. And we have to make this personal, and I do. I'm a mom of a 9 and a 12-year-old, two daughters, and I try to talk about what I do for my own family. I think it starts there, and there's many of us who could have that individualized, personal conversation. It's going to take time to do that, but I think it's important, it's foundational, and I think ultimately builds us towards a healthier country.
So I want to touch on another area. Over the years in our various medical foundations, we have interacted with a number of leaders from the military, particularly when they themselves have been diagnosed with cancer or some other life-threatening disease. And one of their shocks is the technology level in the medical care service system versus the data they have available to them in the military to make decisions. The challenge is, how are you moving the CDC today to take advantage of AI and other things once you get the data? How are you bringing the healthcare and industry up to the level of some private industry or the military in some cases.
Yeah, data is absolutely critical if we're going to protect the health of this country. And we've made some progress, but I need help from Congress and others to make sure we continue to make progress, both for resources and authorities. But right now, and I've challenged our big health systems across the nation, our EHR partners to really invest here with us, because we can do better in terms of data interoperability than we're doing right now, and public health has to be at the table for that. Most of my career actually was not spent in public health. It was spent on the health delivery side, and I think we have learned how silos were not our friend. Health delivery was sitting over here, public health was sitting some siloed, and our data didn't talk to each other. In North Carolina, I led through the COVID crisis, and one of our first things that we had to do was stop receiving lab data by fax machine. Yep. Embarrassing. So, right, we've moved past that. So there's been a lot of investment, but we have to keep going. So we're really focused this year on getting more electronic case reporting. This allows for faster identification of those health threats. And we can do it. The technology exists. We just need to use it. And as far as AI, we already are thinking about what are the really important use cases for AI for public health. Think about all of the data that's out there and how do you detect signal to noise? How do we use large language models? So we're not just looking at ED syndromic data, which we have for 90% of the country, which is great, but how do we also look at what's happening online and conversations on social media that might identify for us a problem that's happening in a community? So lots of opportunity in the future. It was why I'm hopeful for the future, but we have to invest and make sure that we are working together as one team around data.
So what you might not also recognize was Mandy, she was perfectly situated. 1 hour from DC and 1 hour from CDC headquarters in Atlanta and Raleigh. So she's been able to bridge both worlds. Thank you for joining us today.
Thank you, everyone.